Welcome aboard. If you're watching this video, then you have been successfully hired by Florida Hospital, and this is your very first day of training. Let me be the first to say, congratulations.
Can I therapy a patient physically now?
Hold on there, you have a lot to learn before you are ready to therapy a person physically. As you can see with this graph, not giraffe, the rate of infection in the healthcare setting, such as a hospital, has increased with both workers and patients alike due to the lack of competency of standard precaution. Standard precaution is defined as the practice of preventing the infection from one person to another by separating susceptible hosts from potential sources of pathogens. Every physical therapist must comply with a strict set of hand hygiene protocols. The method of choice for patient care situations is hand sanitizer, but in some instances, soap and water is more appropriate, such as situations as if there is blood dirt present on the hand, if the pathogen is C. difficile, or after 10 consecutive uses of hand sanitizer. Mr. Pateros, are you ready to prepare for your patient? A good physical therapist always scrubs his hands thoroughly for 15 to 60 seconds. Be sure to wash under those fingernails. Be sure to wash both sides of the hand. And be sure to wash in between the fingers and thumbs. Good. Now don't forget to turn off the faucet. Wait! Use this to turn it off. And don't forget to dry your hands completely after. No. That is not how you sneeze in a healthcare setting, or, as we like to say, show proper cough etiquette. The healthcare provider should always cover nose and mouth with tissue when coughing or sneezing, cough or sneeze on upper sleeve or elbow, or separate yourself at least 3 feet from people with respiratory infections.
Can I therapy a patient physically now?
No, we're not done. Now, when associating oneself with the patient you are about to treat, it is good to remember that these types of equipment are vital in protecting yourself and your clothing from coming into contact with potential pathogens on the patient and the hospital environment. We call these items personal protective equipment. Gloves would be used when your physical therapist will come into direct contact with an infectious patient, coming into contact with the patient's fluids, or handling contaminated equipment. Have cuts, wounds, or sores on your hand? You best believe you should be wearing gloves. Remember, if it is wet and it's not yours, wear gloves. You don't want those nice clothes to become contaminated with infection, right? Wear your gown. Now, remember, the gown should cover the arms and the front of the body to at least mid-thigh. When using face masks, goggles, or face shields, the intent of these devices is to protect your face region against body fluids and secretions. Ew. Yeah. You can also place a face mask on the patient so to reduce the spread of infection. Not only is your patient a reservoir for infections, but the environment you are standing on is filled with transmissible infections too. To reduce transmission of infections within the environment, use cloth sheets on the treatment table before placing the patient on the bed. If there is blood or infectious materials found, throw into the biohazard container. Once you finish an appointment with the patient, wash or throw the linens depending on what type of linen you are using. Before using equipment that will come into contact with the patient, clean it using alcohol wipes. Once done with sharps such as scalpels and needles, one should discard them in the sharps container. Now that we've covered all these standard precautions in depth, It seems like you are ready to go out there and therapy a person physically now. Are you ready? Then stop moping around and get to work.